Hello, I'm Leigh Kinsman from the School of Rural Health in Bendigo, and today I'm talking to Professor Stephen Campbell, who's a Professor of Primary Care Research from the University of Manchester in the UK. So I have a few questions for you, Stephen. First of all, welcome.
Thank you very much.
But first of all, why is primary care important?
I think there's multiple answers to that question, and they're based around the evidence base of primary care. If you look at the seminal work of Barbara Starfield, for example, and her colleagues and people who have followed her work, the evidence base seems to suggest that health service systems which are primary care orientated are more efficient and more community orientated, they have better outcomes, and they cost less. And the evidence base would appear to support the fact that, as a central tenet, primary care is a better way forward. However, you have to unpack what primary care means, because it means different things in different contexts. One of the most enjoyable things I do is I teach on the Master of Public Health in the University of Manchester. It's an E-based course, and we have students from all over the world. So if you think that primary care for me is about two major important things, access and effectiveness, in central Uganda, compared to Poland, compared to Russia, compared to the UK, compared to remote and rural Australia, the challenges of access and effectiveness differ, but the central underpinning message is the same. Primary care orientated systems are more efficient.
What is your main research focus yourself?
I've spent 21 years looking at quality of care in general practice and primary care, mostly general practice and increasingly at dentistry and pharmacy and the interfaces within the community. Increasingly I focus on patient safety. I'm the Centre Director of the Primary Care Patient Safety Translational Research Centre, and my focus is on how you define, assess, evaluate and improve quality of care and patient safety. And it brings us back to how we started. The answers to those questions, the questions might be the same in whatever country or context, but the answers could be different.
Yeah. So how does your work overlap with the School of Rural Health? Why are you here in Australia on your third trip to the School of Rural Health?
Well, firstly, better weather, and secondly, I do quite a lot of work across Europe, and I'm part of a research assessment exercise called EPA, European Practice Assessment. And we've done an accreditation scheme for practice management, and we did a project on cardiovascular disease, and how you define it and improve it for three different groups. Those who are healthy or not diagnosed, 18 to 45, those at risk, and those diagnosed with CVD. And we did that across 8 European countries. The interesting thing is, apart from parts of France and Germany, etc., what we mean by rural and remote is a very different context in Australia. So looking at the way in which that same method transfers to a different Australian setting was the reason why we collaborated.
Excellent, good. Well, thank you for your time, and thank you for your visit again.
Thank you very much.